Hypochondriasis, also known as illness anxiety disorder, is a mental health disorder that isn't as widely understood as it should be. It's characterized by an excessive worry about having a serious illness, despite having no or only mild symptoms. Picture this. You have a slight headache, and instead of attributing it to stress or lack of sleep, you're convinced it's a brain tumor. It's an anxiety that can take over your life, leaving you in constant fear of your health. Yet, it's not the occasional worry we all have about our well-being. Hypochondriasis is persistent. It's an intense fear that doesn't go away, even when medical exams confirm you're healthy. Now, you might be thinking, that sounds a little like me. But before you diagnose yourself, let's dive deeper. It's normal to worry about your health from time to time, but for some people, this worry becomes so chronic and overwhelming that it disrupts their daily life. Welcome to our deep dive into understanding hypochondriasis, also known as illness anxiety disorder. Now imagine a world where every ache, every twinge, every unusual sensation is a sign of impending doom. This is the reality for those living with hypochondriasis. These individuals often misinterpret normal bodily functions and sensations as symptoms of severe, sometimes life-threatening illnesses. A simple headache might be perceived as a brain tumor. A bout of indigestion could be seen as a heart attack. The slightest change in their health becomes a source of severe anxiety, and they find themselves in a constant state of worry and fear. Many people with hypochondriasis frequently visit doctors, seeking reassurances and multiple opinions. They might exhaustively research diseases, trying to match their symptoms to various illnesses. On the flip side, some might avoid medical care altogether, consumed by the fear of discovering they have a serious illness. It's crucial to understand that hypochondriasis is no respecter of age or gender. It can strike at any point in life, from childhood to old age, and affects both men and women. It's not just an overactive imagination or a quirky personality trait. It's a genuine and debilitating mental health disorder that can severely impact a person's quality of life. People with hypochondriasis may find it difficult to maintain relationships, excel at work, or even perform daily tasks. They might live in a constant state of stress, their minds filled with worst-case scenarios about their health. The world becomes a minefield of potential diseases and illnesses, making everyday life a struggle. So, hypochondriasis is more than just a little worry. It's a serious condition that can have a significant impact on a person's life. But what causes it? The exact cause of hypochondriasis is unknown. But like many mental health disorders, it's likely due to a combination of biological, psychological, and environmental factors. Now, this might seem a little broad, but let's break it down. Biologically, there could be an imbalance in your brain's serotonin levels. Serotonin is a chemical your neurons produce. It helps with sending and receiving signals. When it's out of balance, it could potentially lead to conditions like hypochondriasis. Psychologically, certain personality traits and thought patterns could contribute. For instance, if you're someone who tends to worry excessively, or if you're overly sensitive to anything related to health, you might be more prone to developing hypochondriasis. Environmentally, your upbringing and experiences play a role. A history of physical or sexual abuse, a serious illness during childhood, or even having a family member with a serious illness can increase the likelihood of developing hypochondriasis. Now let's talk about treatment. If you think you might have hypochondriasis, don't be afraid to seek professional help. A mental health professional can provide a thorough evaluation and guide you toward the most effective treatment. One of the most common treatments is cognitive behavioral therapy, or CBT. This form of therapy helps you understand your thoughts and behaviors, teaching you how to change negative thinking patterns and respond to health-related fears in a more productive way. Medications can also be beneficial. Selective serotonin reuptake inhibitors, or SSRIs, are often used to help balance serotonin levels. Beyond therapy and medication, stress management techniques can be a big help. Regular exercise, a healthy diet, good sleep habits, and mindfulness practices like meditation can all contribute to managing symptoms and improving your quality of life. Yes, hypochondriasis can be a challenging condition, but with the right help and treatment, it's possible to live a normal, worry-free life. So that's a brief rundown of hypochondriasis, a condition that affects millions of people worldwide. It's a serious mental health disorder characterized by an excessive worry about having a serious illness, even when there's no medical evidence to support the presence of an illness. If you or someone you know is struggling with these symptoms, don't hesitate to seek professional help. Remember, mental health is just as important as physical health. Thanks for watching, And don't forget to like and subscribe for more health-related content. Subscribe and don't forget to take care of yourselves. Goodbye.